Hi, beautiful people. So, everybody has been busy talking about fibroid, and nobody has taken the time to talk about another growth that can arise from the pelvic region in women. And this growth is called ovarian cysts. Ovarian cysts are like fluid-filled sacs that arises from the surface of the ovaries. As a woman, as a female, we have two functioning ovaries, and these ovarian cysts can arise either from one of the ovaries or from both. Now, there are different types of ovarian cysts, but the most common ones are the simple ovarian cysts or the functional ovarian cysts. These ones are harmless, they can even come out without causing any pain, and they can also clear or go away on their own. These are the simplest and the most common of the ovarian cysts. Then we have the complex ovarian cysts, the ones that are complex, the ones that are already infected, that are becoming solid. These ones can cause severe pain, these ones can cause infertility, and these ones can cause a person to actually be hospitalized. So how would you know that you have an ovarian cyst? What are the things that will happen to you and you start to suspect that maybe there may be an ovarian cyst? Number one is pelvic pain. Number two is painful periods. Number three, if you're beginning to realize that you're having trouble going to the toilet to do the number two, or you're peeing too frequently. Some of the risk factors for this ovarian cyst is age. If you're premenopausal, that means if you've not gotten to menopause, you're likely predisposed to having ovarian cyst. If you're taking any fertility drug, if you're trying to get pregnant, you're taking fertility medications like Clomid, like Letrozole, you may be at risk of getting ovarian cyst. So you have to take these medications based on your doctor's prescription and guidance. You can't just take these drugs because you abuse them and you upset your hormonal balance. And most of these growths, these masses, they are hormonally inclined, which means that hormonal fluctuations can cause them to grow. So if you're taking any fertility medication, you might want to think about getting a doctor's input or advice going forward. The simplest way to know if you have ovarian cyst is by doing a pelvic ultrasound or by doing a procedure we call laparoscopy, where we pass a thin small camera into your body to see what is going on with your inner organs. How do you treat ovarian cyst? You can treat an ovarian cyst through surgery. Yes, you can do a surgery to remove those growths, those masses. You can do a surgery to remove them, or you can be placed on medications that contain hormones that will help to regulate your body and help cysts not to form in the future. These hormonal drugs can be birth controls or contraceptives sometimes, but you have to work with a gynecologist. So that's it from me, guys. If you have further questions regarding ovarian cyst, or you know someone who has an ovarian cyst, or who is suspecting that they have an ovarian cyst that may have a question, you can drop it on the comment section and I'm going to answer all of them. Thank you so much for staying through to the end of this video. I will see you on my next one.